And to our presenters, you can begin whenever you're ready. Thank you.
Okay, thanks. I'm Russ Glasgow. As you can see, Meredith Fort is next to me up there, and I see we neglected to put where we're from. So we're both from the University of Colorado. Meredith's with the School of Public Health, and I'm with the School of Medicine there. And we're looking forward to a session with you this afternoon, and it looks like we have a relatively small number of people, so that will be great to enhance our discussion. If we could have the next slide, Meredith. This is going to be a little different than most of the sessions so far. And in order to make it work, we're going to need two things from you. The first one is that we'd really like you to go to, in the workbook or the worksheet you have for the conference, to go to pages 86 to 88. And then either, if it's possible, to please print that out, or if not, if you have a second screen or something, if you want to put those worksheets up there, because they have a number of questions that we're going to go over. So it will really help a lot, I think, what you'll get out of it. If you have that, and then maybe you can even start filling in some of those issues. And then the second thing that we're going to need is for you to use chat liberally. With Meredith and I are going to trade off, so it'll help us a lot, but we will monitor the chat. We're going to try to power through the slides that we have. I think we have fewer than 10, so we have plenty of time, but please do as we go along, particularly if we go over something too quickly or it's confusing, please shoot something into the chat. So with that, unless Meredith, is there anything else you can think of before we start rolling with the slides?
No, I think we're ready to start.
Okay, well, let's go then. We're talking, yeah, go ahead with the next slide if you would, please. We're talking about two important issues in pragmatic research that, at least in our perspective, are recognized as being really essential and important, but we feel are actually under-reported and underemphasized, actually. Just start out with a couple definitions. I'll start with the second one first. This is the most broadly used one from the kind of classic text in D&I by chapter by Rabin and Brownson there, that talks about reach, kind of combines the two. Reach is the ability of a program to engage the ultimate target audience, both in terms of quantity, being the number or percentage of participants, and also quality, which technically is our second construct of representativeness there. As some of you probably know, Meredith and I both use REAIM, not exclusively, but a fair amount. And in REAIM, reach is defined very similarly, but with another nuance, as the number, proportion, and the representativeness of individuals that will participate in a program. I should also note, we don't have on there, but we think it's very important to also understand the why and the how that participation takes place through the use of mixed methods. Going down to the bottom, representativeness now refers to whether participants have the characteristics, okay, that reflect the target population. So it's not just the percentage, but it's the characteristics, it's the who, and again, the who and the why. One thing that isn't on there, and then if you want, you can go ahead and start chatting. I'll come back in a moment, but if you see the question at the bottom there, we just like from each of you, where you are, there's no right or wrong answers, but if you just start typing into chat, why do you think reach or representativeness are important? Or if you don't think they're important, put that in too. But I do want to mention one other term and related construct to representativeness, and that is of representation. And by that, what we mean is it's the engagement or the level of involvement or the representativeness of the stakeholders that are involved throughout your project, all the way from planning to execution to interpretation. And it's really the voice of the community that's involved there. both in terms of designing the program and also really as being part of the research team. So you've heard a lot about stakeholder engagement already, but this is a key issue that we also think is important to keep in mind. Why don't you go to the next slide, if you would, Meredith, and we'll just see, kind of watch what's come in here in chat. Maybe you can you can help me to monitor that. So I think we just have one slide each on some of the details on measuring reach. And again, for now, we're going to talk about reach focusing on the percentage of the people that participate overall, or if you will, the fraction, the numerator, just those who participate, and pretty much everybody reports in a study. And second, the denominator. So again, it's a fraction, which often is trickier and isn't as readily available sometimes. But you need both, obviously, the numerator and the denominator there. And we usually report reach using one of two denominators, and sometimes I think it's maybe most informative to report both. First one is the denominator of people that you actually approach or you invite to participate. The second one, and this works, I think, often better, is more possible if you're doing something like a policy or something that's involved. That's the larger, and again, we think the local or the community population who might benefit. Very importantly, and we'll come back to this issue, the second point on transparency. It's really important for reporting for reasons of potential replication and generalization that we also know who's excluded. And when you participate, not just who participates, but who's excluded and doesn't have a chance to, and also if this changes over time. Third point there, it's really important to understand, if possible, both quantitatively and qualitatively, why people don't participate. And you can see a variety of issues there, and especially some of those that may have to do with cultural, historical issues, could involve things such as trust, language, documentation status. One other point at the very bottom, because we frequently get questions about this, is that many of these same principles of participation, percent, and representativeness also apply at larger sociologic levels. For example, if you do worksite or school work, it's participation of those settings. If you do work in a health setting, it might be both the setting and the staff levels. These apply, but those are technically different. And today we're going to focus at least most of our attention at the level of the individual participant that takes place. So next slide, please. Okay, so in terms of representativeness, then, we're now talking about what are the characteristics or the factors that are really important to understand this participation. And again, essentially, we also want to focus the bottom line being on the eventual population or the public health impact. So there's almost an endless number of things. Participant characteristics is, almost like context. It could be anything, but you need to focus on a few things being pragmatic. So we recommend two things in particular. One of them is that you consider issues related to health equity and social determinants. That could be demographics, but hopefully you can go beyond this to other social needs and factors. And then secondly, we recommend trying to assess the factors or characteristics from what you know about existing research and your experience, practical experience, that you expect to be most strongly related to your program outcomes. Now, there's a variety of sources. We'll have time to get into this later, and we do have some resources on the back of your handout there on the final page. But there are three classes of buckets that you could do. The first, to assess characteristics, are data that you collect yourself as part of your project, including ideally, if you can collect at least a small amount of data on non-participants as well as participants. Second, some type of a local data source administration. This could be, for example, electronic health record, or like in a worksite, an employer database that you have. And then the third one is data that may be available from various administrative or, quote, outer context factors, and increasingly things like geospatial data, be they census or other factors. So with that very quick intro, I'm going to turn it over to Meredith to give us an example, unless she thinks we should pause first to address any question here.
Maybe I'll just very quickly read off the chat in response to why reach and representativeness are important. So Holly says that critical to know how an intervention works for different people, need reach and representativeness to get a good sample to answer that. And then Marie says it's important to be able to know whether spread and scale is equitable. Okay, and we'll have lots of time to discuss those ideas more. So I'm going to walk through a concrete example of reach and then representativeness from a current type 2 hybrid cluster randomized trial that I'm a part of, which is aimed at improving hypertension control in Guatemala. And this is preliminary data that was put together for our recent annual study meeting. And it was prepared by the Institute for Clinical Effectiveness and Health Policy, which is a part of the project as well. And this probably looks like a similar table to what many of you have put together in terms of comparing intervention and control groups and having a total column as well. And you can see there's, some differences, but a lot of similarities in terms of the characteristics. Maybe nothing or not many of them really stand out as being substantially different, which is, I think, pretty common for this kind of a study. And so we're looking at the male versus female participants, the average age, if they're employed or not, if they're of Mayan ethnicity, if they primarily speak Spanish, and if they're literate, which were some of the key characteristics that we did have available to us. There were others that we had as well, but this is just a selection of them. And then in looking at representativeness, we've just started to do some comparisons, drawing on the 2018 census, which we had available to us, not for all of the characteristics, but for some of them. And there, certainly you'll notice some differences in terms of the population. And I should note that it is for a study population that is similar. So it's not going to be identical, but also for those who are aged 40 or older, which is one of the criteria for being included in the study, and people from the provinces in which the study is being implemented. But you'll see here that there are some differences which are important to take note of, and I'll do a quick summary of those on the next slide. So what we see from it is the population in our study is majority female. They're older. There are fewer identifying as Mayan, fewer employed, and have lower literacy. So just some of the questions that come to mind in thinking about how to enhance reach and representativeness of this program and this approach as we move forward is, how can this intervention engage more men? How can people who do self-identify as Mayan be engaged equitably? And how can people who are employed be reached, because they're less reached at this point? The less participation from them at this point in this study. So I'll move on now to some tips that we have of how to enhance reach and representativeness, and we'll look forward to hearing from you as well. So feel free to put in the chat now if you have other ideas that you think are important. So definitely one of the topics that has been highlighted is the importance of participatory research and engaging stakeholders or community partners in building relationships. Considering the barriers that may prevent some people from participating and thinking about how to address those or adapt the intervention or the implementation strategies to enhance reach and representativeness. Also, the third point is, it's important to iterate, if possible, capture throughout the period of recruitment and make changes as you go, if you're able to do that to try and enhance reach and representativeness. And then determine what recruitment materials are feasible and best for your program, and getting input on those in the development in terms of the content and the appropriate reading levels for the recruitment materials. And the next point is really to think about going to where the target population is rather than expecting them to come to you, because that can be one of the groups that's being missed. And that's related to this issue of barriers that's limiting their participation. And then, and this is very relevant from the project that I just shared, and the work that I'm involved with is communicating in the languages that the population that you aim to include and is most comfortable using. Then I will turn it back over to you, Russ.
Okay, just as transitioning a couple comments there. The first one is this issue of representation again. I think many of those tips that Meredith went over, and those are included in your handout, by the way, are really enhanced. A good way to get a handle on that is to work with people from the community who can inform you about that rather than just making an armchair guess. Second, the issue that Meredith talked about recruitment, I think is ubiquitous. Almost every, at least large-scale project I've been involved with has run into at some time or another recruitment challenges. And this notion of having to adapt on the way, maybe add or look at different settings is really important. This is the next page of your worksheet, page 87. And again, you might want to both go to that, and then I'd really like you to start using the chat actively now as we go to the next slide. This one is where the fun part begins, or sometimes the frustrating part. What are the complexities and challenges? So far, it's been fairly straightforward. I hope the definitions we've given you, but when you try to apply this to a real world, messy, pragmatic study, sometimes it's not quite so straightforward. One issue that comes up is, well, what if you really can't totally define your denominator? Let's say you go out and you're doing some type of public advertising, social media, or the old days in the newspaper, something like that. And you don't really know how many people, have received your invitation. In cases like that, we recommend, there's several things, but one of them is what we call a sensitivity analysis. And what you do is you put in both a high and a low guess of that you're pretty sure kind of bounds, if you will, kind of the truth or the whole aspect to kind of get at least a ballpark estimate on that. The second point is, and this is an interesting one, a little more subtle, and why we figure it's important to assess multiple implementation outcomes. So in a study, not just to assess reach, then another study to assess implementation, and a third one to assess something like effectiveness or adoption, is that it's possible if you really push hard to maximize, in our case, reach, you may well have inadvertent negative impacts on effectiveness. And a classic one might be with reach. If you really try to get everybody, and there are no barriers, no criteria to come in, no commitment that's required, you may well find that people don't have much and your effectiveness is reduced. The third point I want to emphasize, this is one of my soapboxes, is that it's critical to really transparently report. There's a couple tools in there and reporting standards in your references there to promote replication so we understand who it is that is participating, who didn't participate, and equally importantly, who was excluded, either intentionally or unintentionally, didn't get invited ever to the party. I want to stress, because we don't see this near enough, that there's not anything bad about if you have low participation or unrepresentative participation. Often that's just the way it is. Meredith reported there about some differences in what she found. But it's important for us to know this, because often what people will do is not do that, but then they'll end up concluding, or readers will, that then you can generalize your findings to any population or group. And then the final point is a little more straightforward, is that over time, your reach or representativeness can change. It may be you, first of all, get the quote early adopters and things, and they have certain characteristics, but then after that, you don't. And so tracking this, like many things we've talked about over time, is really important. So I'll pause there. And I think we're done with the slides we need to go into. Is that right, Meredith? Or do we have another one? And is there anything you'd like to weigh in on or extend?
I think we can, we have one additional slide that we can save for a minute and open it up and hear what you all, either tips that you have for increasing reach or representativeness, or thoughts you have about what we've shared so far, or questions.
Are we the only people that have had challenges with recruitment and reach, or others? Again, I'll just reflect back while you can unmute yourself, by the way, too. I think we've got a small enough group if you'd rather comment verbally than in chat. But that Meredith found out, like in hers, that often you do find when you look that there really are challenges there. I think for many of us, particularly if we work with older population, getting males to participate is quite often a challenge to do that. And then, of course, historically, getting populations that are lower income, that have social needs challenges and things has been kind of a ubiquitous issue or challenges. So it looks like we just had a good question from Ramona that looks suspiciously like Dennis. See, what can you do if you have a hard time getting the actual denominator? Okay. Again, maybe we can both take that one, and you all can add in here too, because I don't pretend to have the answer. I usually like to try, first of all, from whatever sampling base that we're using, be that, say, a list of, in a primary care setting, I know Dennis works, a list of all of the patients there, kind of an anonymized session, so you're not getting any HIPAA information or things, but like for the entire population, who is there. And then what we like to do, there also can be different levels of, if you will, invitation or whatever. Some of them can be, again, I'll just use the example of a primary care doctor's office. It could be just people who came in for an appointment, and maybe there's a poster, or the rooming in person had a handout that they did. That's kind of a real low level participation or code invitation. And then there might be another more formal one where something is actively sent out to the participant, or who they are. So again, this notion that we like of what we call a sensitivity analysis, so that you report kind of using both denominators that you have there, or to give a high and a low bounds. So Dennis, you can unmute yourself if you'd like. I don't know if that makes sense or you have other thoughts, or Meredith, if you'd like to add to that.
That's great. That's giving me ideas for Invested already. So thank you, Russ.
Great. I might just add, and I think it's similar to what you were sharing, just keeping track of people who decline participation, and then, if possible, following up with them, and then if you are able to capture some characteristics of them, seeing some of those differences. I'll take the next question. From Rachel Steinberg. Says, do you have any advice for reporting reach related quantitative data like you're describing here integrated with qualitative data? Participant examples of participant interview responses about what motivated them to join, staff interview responses about the recruitment strategies that did or didn't work and why. I think that's a really important question. I think we're both advocates of combining quantitative and qualitative data, and just maybe give a shout out to an article that Jody Holtrop led on re-aim and qualitative assessment, which has some good questions that combine both quantitative and qualitative ways of getting at reach and the other dimensions of re-aim. Russ, is there anything else that you would want to add to that?
No, I don't think so. Well, maybe just one minor thing. We do feel, when possible, this notion of hearing a little bit to get the perspective from people who decline to participate. And there can be some tricks, but you need to work with your IRB about that if they decline to participate. But often you can just ask if people would be willing to answer a couple questions without providing any other information to that is usually okay. And it doesn't need to be a really large percentage to get a feel for that. Once again, then, this notion of representation, if you do have members of the target group or the population working with you as part of your team, they can help you kind of at least make some informed guesses about that. Let me take a shot at the next question, if I could there, about this issue that we brought up about maximizing reach can impact outcomes. We certainly do. And so, Meredith, this gives us a chance to use our other later slide, I think, if you want to go ahead and turn to that. But first of all, to address the last thing that Marie says there, talks about intentional thinking through all the various phases. Most D&I frameworks do talk about implicitly or explicitly different phases of research. EPIS, for example, real clearly about 4 different phases. But I think this notion of always thinking ahead to the sustainability of your strategies, including like your recruitment or promotion strategies. Can you continue these things on an ongoing basis? If you're looking for a program that's going to stick and your stakeholders are going to use after your formal research is gone, you need to think about the amount of effort, time, resources, staffing that go into that. But just to take a quick example here, we've actually seen something real similar. This is, for explanatory purposes, is a hypothetical example, but again, using our re-aim framework, as you can see here, with the levels going from high to low on the left-hand side, and then the different re-aim phases here. This illustrates, the dashed line illustrates a relatively high reach that was involved, but then, as I mentioned before, a much lower efficacy or effectiveness study, and some other factors that often we see there to a greater or lesser extent. But just look at the first 2 dimensions, kind of the crossover. In contrast, and we see this a whole lot more, is that the solid line there is selected, as we often do. We take a, quote, evidence-based intervention. And often the way we get a really strong efficacy evidence-based intervention is that we require a whole lot of participants, like they need to come to 16 sessions in a diabetes prevention program. They need to travel out of their home to come to a horribly crowded medical center that you can't even park at or something. people that do that are going to be more likely to have a good effect of that. But in that case, you might, as you see there, have a really low reach, or you're sacrificing that. So often what we're looking at is a balance. I don't have the time to go into the other things, but it's just, again, as Marie said, being thoughtful about this and realizing that the old maxim, you often can't have it all. And if you're totally maximizing one dimension or like reach, that may have some other impact, as well as what may happen later on. So Meredith, do you have another example, or do you want to comment on that a little more?
I think it's a very important question, and maybe just building off of what Russ shared, it's important upfront to talk through what the priorities are for your collaborators and community partners, to see what they, recognizing there are some trade-offs across the different dimensions of REAIM. So to make decisions based on what they consider to be most important. And I think that's a great example. And I was just going to make a comment, and this is a slightly different topic, and I know we have just a couple minutes. I think building off of the comment that Russ shared previously about transparency, and this is thinking about representativeness at different levels. So this is kind of expanding a little bit beyond that individual level that we had shared in an example and we talked about more, but thinking about the importance of, of the sites that you've selected to participate in your study or your program, how representative they are. And I know that data for that can also be challenging, but I know it's something that we're trying to do in the study that I shared the example with you, of looking at administrative data and just recognizing that there were some decisions that we made up front to exclude some of the sites because they didn't meet the criteria of having 2 providers at a health post. But then, realistically, if we want to scale up the intervention in the future, that's something that we can run into as a challenge, is a capacity issue in the future of not having similar sites to scale up to. So that's a different kind of example of a trade-off, but also one I think that's important in a slightly different application of representativeness, but one that I think is probably fairly common also for the kinds of programs that you all may be involved with.
I think that's a great way to kind of start wrapping up here, Meredith. I will just refer you once again to your handout there that we hope has some thought questions for you to reflect on and think about it in your own research. But that issue is better than the one I gave about transparency, because I see that a whole lot. Is that people, again, I'll go back to the primary care example that I have all sorts of restrictions, including like how sophisticated is their EHR, how stable is the staff. Meredith mentioned some other ones there. And there's nothing the matter with requiring or excluding those that don't meet that. From my perspective, though, the problem is when you don't report that transparently, and then people assume that this will work in any kind of setting there. And I think that's responsible for at least a moderate amount of our representativeness issue. Last thing I'll leave you with, and I'll let Meredith have last word, and you have a break before you get to your next session, is that there are an increasing number of resources available based on geospatial data. I think particularly around issues, social determinants like social deprivation index, some good census data and things like that, there are a few starting places in the handouts, but I'd encourage you going forward to look to that, as well as some of the other sessions here that talk about secondary data that probably know far more than I do about that anyway.
Great. So I think we're right at time. I think we can stay on if you have any additional questions that you would like to talk over for the next few minutes. But thank you all for your great questions and contributions, and feel free to reach out to us if you have any other thoughts or questions.
Thanks all.
I
I actually do have an additional question, if you are okay staying, that I just thought about. Thank you for that offer. So for my dissertation, I've noticed that we've gotten a lot fewer participants than we normally get for the intervention that we do. And this could be because of COVID and a variety of different things. But it does make me think a little bit about reach, just given that we're asking people to do a lot of research. So I guess I was just curious how you kind of take into account the fact that there's a research burden, which is more than just the burden of the intervention, and how you consider that.
You want to go first, Meredith? We'll try to be succinct here.
Why don't you go first?
Well, I actually have sometimes talked about reach being, if you will, the real pragmatic reach, non-research reach or program reach, and then the research project reach. And the key issue, I think, is the consent form. Do you need written consent or not? So first thing we'll try to do is minimize that. So we work with our stakeholders so it can be considered not research where we can, or so the consent is the less, not least obtrusive that can be possible. We will look at sequentially, when do we lose people, and how many of them do we lose at that stage there. But then again, this planning ahead for later adoption or whatever, trying to see how you can remove those type of research requirements. I might refer you back to the PRECIS 2 session that was done, or you can look up here that was talked about that. So.
Great. So I think we need to wrap up so we can turn it over to get the next presenter situated. But Victorine has a question. If you wanted to reach out to us, I can put our email in the chat. We can try and answer your question that way.
Okay, thank you so much.
Yep, thank you.
Thank you, everybody. That concludes our this presentation. If you'd like to stick around for Graham Moore's presentation, that will be starting in just a moment. Thanks to Russ and to Meredith.
Thank you.